Hi, my name's Christian. I'm going to be your student nurse today. How are you?
Good, how are you?
Good. Can I have you state your name and date of birth for me?
Tara Ryan, 12/8/94.
Perfect. And can I just match that to your wristband real quick? So what patient states is matching with her bracelet on her arm. So I'm going to ask you a couple questions real quick. Can you tell me where you are right now?
I am in Saco, Maine.
Okay. And can you tell me who the president is?
Obama.
All right. And are you in any pain today?
Nope, no pain.
On a scale of 0 to 10, how would you rate it?
0.
0. And do you use any assistive devices?
I have glasses.
You have glasses, okay. Any trouble smelling, tasting, or hearing?
Nope.
All right. But you're able to understand me okay today?
Yes.
Okay. So before I jump into anything, I'm going to do sensation. So I'm going to touch a couple parts of your body with your eyes closed and have you tell me what they are.
Okay. Left arm. Right leg. Left thigh. Right shoulder.
Perfect. All right. And while we're right here, I'm also going to test your musculoskeletal strength. So if you can push up against my hands and down, and then if you can raise your arms out, push down against me and up, and then squeeze my hands. And then for your legs, can you push against me and down, and then up against me with your toes and down. Perfect. So muscle strength is a 5 out of 5, so normal findings. I'm going to have you test your neck real quick, so you can bend it this way and this way, forward and back. Range of motion in the neck is normal. Before I get any further, I'm going to ask you to remember 3 words for me. Can you remember boat, fan, and beach for me?
Boat, fan, beach.
And then at the end of the assessment, I'm going to have you repeat those to me. Okay? All right, so I'm going to now assess your hair and your head. So while looking at your head, it is midline, proportional to your body. It is erect. Your hair looks full and no signs of alopecia. It's thick. Your hair on your eyebrows and eyelashes are also present. No signs of any alopecia there either. Your eyes, nose, mouth, and ears are all centrally located, proportional to your body, and bilaterally equal. I'm now going to palpate your head for any masses. I don't feel any masses. I see no signs of critters, and no lesions on the scalp. I'm now going to take these off and re-sanitize. And now I'm going to assess for TMJ real quick. So if you could just open and close your mouth. No signs of TMJ. And now I'm going to check your ears for any drainage. No signs of drainage. Any trouble hearing at all?
Nope.
All right. No drainage in either ear. I'm now going to assess your eyes. So I'm going to do 3 different tests. So if you can look right at me, I'm just going to test your pupils. Perfect. Pupils are equal, round, and reactive to light and able to accommodate. They're about 3 millimeters in size. And now I'm going to do the peripheral vision test. So just let me know when you can see both of my fingers.
Now.
All right. Peripheral vision is in contact. And now I'm going to do the 6 cardinal signs of gaze. So just follow the end of my light and try not to move your head. Six cardinal signs of gaze are in contact. Conjunctiva is normal, no signs of redness or irritation. The sclera is white and the iris is brown. No drainage or anything from the eyes. Nose, I'm going to have you check the patency, so if you can just go on one side and breathe in, and the next. No signs of any trouble taking in air through her nostrils. I am now going to check your mouth, so if you can open it and just say, ah. So teeth are clean and show good oral hygiene. Her uvula is midline. Tonsils are not swollen, so she has no signs of infection, and her mucous membranes and oral membranes are moist, and it shows that she is well hydrated. So now I'm going to check for your thyroid and trachea. So if you will just swallow for me real quick. I can't palpate her thyroid, so that's a good sign. And her trachea is midline to the body, well proportioned. I'm now going to check her Her accessory nerves and cranial nerves. So if you could smile for me, frown, puff out your cheeks, raise your eyebrows, and shrug your shoulders. So accessory nerves are in contact and able to use them. I'm now going to look at her skin. So her skin is dry. It is warm to the touch. It appears normal for her. It's even color throughout over her body. I'm now going to look at her skin turgor. No tenting. Capillary refill under 3 seconds. I'm now checking bilaterally. No tenting and capillary refill under 3 seconds. So now I am going to check her maxillary and frontal sinuses and her lymph nodes for any tenderness or pain. So if you experience any pain, just let me know. Any pain there? No pain, no tenderness in her frontal or maxillary sinus or her lymph nodes. I am now going to assess for crepitus and range of motion in her upper extremities. So if I could have you do a big circle with your shoulder. Perfect. Any pain?
Nope.
And in your elbow, flex and extend. And rotate your wrist. No crepitus or pain in the right side upper extremity. And the left side, rotate in a circle. Flex and extend your elbow. And rotate your wrist. No signs of crepitus or pain in the left extremities. I am now going to assess for her pulses. So I'm going to start with her carotid. And her radial. Her posterior tibialis. And her dorsal pedis. And skin turgor on the feet is normal, no tenting, and capillary refill is 3 seconds or under. All of her pulses are good strength. They're bilaterally even, no discrepancies. I am now going to have you stand for me. And if you could take 3 steps that way and then 3 steps back, please. Her gait and balance are even. She's able to stand erect without any problems. Now I'm going to perform the balance test. Could you please lift one leg and then the other? Patient has good balance and good posture, is able to stand erect. If you could now come this way and then face that way and bend over like you're diving. I'm now assessing the spine for any curvatures. No signs of scoliosis or any deviations from the center midline. You may now come up. And then if you could take a deep breath, I'm going to check for lung expansion. Lung expansion is normal. My thumbs move away as she breathes in and out. I will now assess for crepitus in the lower extremities. So I'm going to put my hand on your hip, and if you could move your leg forward, backwards, and to the side. Perfect. Any pain there? No signs of crepitus in the knee and the ankle. Perfect. And this side, same thing. Perfect. And the knee and the ankle. No signs of crepitus or pain in the right or left lower extremities. She is able to move full range of motion. I will now have you face that wall, and I'm going to listen to your lung sounds. So each time I move my stethoscope, if you could just take a deep breath.
Sure.
All right. Perfect. And then if you could turn around and face me, I'm going to listen to 4 more spots. Lungs are clear. No signs of any wheezing or rhonchi. No difficulty breathing. Her chest size is symmetrical and expands normally. I'm now going to listen to your cardiac signs, so you can just breathe normally for this. Heart rate is normal, no signs of murmurs. Patient doesn't seem out of breath with breathing. I will now have you take a seat, please. And I will have you lay down now. So now I'm going to perform the abdominal assessment. I'm going to be checking her 4 quadrants for her GI system to hear for some noises. And I am also going to be assessing her renal arteries and her aortic artery to make sure I'm able to hear her vascular sounds. So I'm first inspecting and I don't see anything, so I'm clear to osculate. All right, so now I am clear to palpate because I just osculated. All right, you may now sit up. So her vascular sounds are normal. There's no masses or lacerations on her skin. I can't palpate any masses. So now, can you remember the 3 words that I told you?
Boat, beach, fan.
Perfect. And I'm just going to take a second to run through everything really quick. I'm going to have you do your fine motor, so if you could just do thumb to finger, back and forth. Perfect. All right, I believe I am all set today. Is there anything else I can do?
Yep, that was great.
All right, thank you.
You're welcome.